Is your baby fussy lately? Are they more irritable than usual and you can't seem to figure out why? Are they drooling more than usual? You might notice their chin and clothes are constantly wet. These could be signs of teething. Teething is a natural process that every baby goes through. Teething is when your baby's teeth start to push through their gums. This process can begin as early as 3 months or as late as 12 months. It can be uncomfortable for babies. They might experience swollen gums and mild pain. They might start drooling a lot. Excessive drooling is one of the most common signs of teething. You might also see them chewing on things more. Babies often chew on toys, fingers, or anything they can get their hands on to relieve the pressure on their gums. Some babies get fussy and cry more. This is their way of expressing discomfort and seeking comfort from you. These are all normal parts of teething. It's a challenging time for both babies and parents, but it's a sign that your baby is growing. Teething usually starts around 6 months old. However, the timing can vary widely from one baby to another. But all babies are different. Some might start teething earlier, while others might begin later. Some babies start teething earlier, some babies start later. It's all part of their unique development journey. If you are unsure if your baby is teething, you can always ask your doctor. They can provide guidance and help you understand what to expect during this phase. Teething can be tough on babies. It's a challenging phase where their tiny gums are sore and tender, causing them a lot of discomfort. As their first teeth start to push through, the pain can make them irritable and fussy. Their gums are sore and tender. This soreness can lead to a lot of crying and sleepless nights, both for the baby and the parents. Babies often try to find relief by chewing on anything they can get their hands on. This can make them uncomfortable and fussy. They might cry more than usual and have trouble sleeping, which can be exhausting for everyone involved. It's hard for babies to understand why their mouths hurt. They don't know why they're in pain, which can make them feel even more distressed and confused. They might not be able to tell you what's wrong. This lack of communication can be frustrating for parents who are trying their best to soothe their little ones. This can be stressful for parents too. The constant crying and fussiness can take a toll on parents, leaving them feeling helpless and exhausted. Parents want to help their babies feel better. They try different methods like giving teething toys, massaging the gums, or using cold compresses to provide some relief. But it can be hard to know what to do. With so many options and advice out there, it can be overwhelming to find the right solution that works for your baby. The good news is there are simple ways to soothe your teething baby. With patience and a bit of trial and error, you can find what works best to ease their discomfort and bring back those precious smiles. One of the easiest ways to soothe teething pain is with a teething ring. Teething rings are made of firm, chewy material. Babies can safely gnaw on them. The pressure from chewing helps to relieve gum pain. Another way to ease your baby's discomfort is with a gentle gum massage. Wash your hands well. Then, gently rub your finger over your baby's gums. The pressure can feel good on sore gums. How to use teething rings and gentle massage effectively. When choosing a teething ring, make sure it's the right size for your baby's mouth. It's important to select a teething ring that is appropriate for your baby's age and developmental stage. Some teething rings are designed for younger infants, while others are better suited for older babies. It should be big enough that they can't choke on it. Always check the manufacturer's guidelines for age recommendations and safety instructions. But it should also be small enough for them to easily hold and chew. Babies need to be able to grasp the teething ring comfortably to get the most relief from it. Look for teething rings made from non-toxic materials. This ensures that your baby is not exposed to harmful chemicals. Many teething rings are made from silicone or natural rubber, which are safe for babies to chew on. For a gum massage, use a clean finger and gentle pressure. Make sure your hands are thoroughly washed before you start. This can help to alleviate some of the discomfort your baby might be feeling. You can massage your baby's gums for a few minutes at a time. Be attentive to your baby's reactions and stop if they seem uncomfortable. Most babies find this soothing. Regular gum massages can be a great way to bond with your baby while providing them with much-needed relief from teething pain. Happy baby, happy parents. The joy of relief. After using a teething ring or gum massage, you might notice your baby seems happier. They might stop crying or fussing. This is because the pressure on their gums has helped to relieve their pain. Remember, every baby is different. What works for one baby might not work for another. You might need to try a few different things to find what soothes your baby best. Monitoring and when to seek professional help. While teething is normal, it's important to keep an eye on your baby. If their pain is severe or doesn't improve, talk to your pediatrician. They can check for any other problems and offer additional advice. Teething is a temporary phase. With a little patience and these simple tips, you can help your baby feel better and enjoy this special time in their development.